topic, Lightbody surgery. In the consideration of methodology of Lightbody surgery, let us first explore how it's done by those who are using methods of the faith healing or psychic surgeons in the Philippines. These psychic surgeons or faith healers rely on an innate ability to effect change because of their connection to their lineage. And when their hands move within the body, it's actually thousands or hundreds or 10 or other number of guides or spirits that are near in that portal helping that psychic surgeon doing that work. So they are all participants in this work, and they are, some of the more skilled ones actually participate in the surgery by actually placing their tiny hands, and they are all miniaturized hands, and they're light body hands, into the area of the portal, the affected area, and work together to do the great number of operations that are necessary to fulfill any particular psychic surgical maneuver or procedure. The moving of the hand through the body is accomplished by placing the hand and the body in another type of time, another type of space. And this is possible through using the faith of the healer and the faith of the patient or those nearby or those who would send their prayers and well wishes towards the operation and individual, thus supplying an intensity of energy that the psychic healer or the psychic surgeon is able to draw upon and focus into the area of the wound or other disease part. In the procedure itself, the hand is the normal method of the healer or the surgeon to perform the surgery. Therefore, the hand must penetrate the body of the patient, and the continuum, light-time continuum that is established through this interchange determines a type of ripple in the space-time boundary, and that ripple extends as far as it is necessary when the actual procedure is guided by lineage members. And when it's unguided or under the direction of the master, then the actual moving of the hand through the body has to be very, very controlled, and each of the cells of the diseased patient have to be totally analyzed, and the entire procedure has to be one in which the psychic surgeon has a understanding of what is actually going on with the diseased part. So medical knowledge to a degree would be handy. Now the difference is that the intuitive healer would not need to know that or to see exactly what is going on, in that their presence in itself is the effector of the change or the healing, and it is through their guidance from the lineage that allows them to make the motions in the body and do the things which they are doing. Now, they may not know they're reaching in to pull out a tumor or to do something else, but that is what they do. And what happens is that the hand of the healer becomes a form of vessel, in fact, a container, not a blood vessel. And the container of this light energy, as it is by the shape of the fingers and the cup of the hand, allow it to shield the disease part from the other parts. So in this entire procedure, the light body of the healer or the master is actually in the body and protecting the body as well of the patient. So this too, if it is not an intuitive knowledge, has to be learned, which is a very lengthy process, unless one can pick up and draw upon the intuitive knowledge of their ancestors, their share in that knowledge of those that have that knowledge, that have the lineage knowledge. And that is why special teachers are necessary for advanced teaching, because there is really, the other way is so much harder and more difficult and takes the brains and time that most people would not find available. Even though this might be a pursuit for those that are pursuing the medical and have pursued it, learned it, and need to augment it through the means of psychic surgery. And this is a methodology that would allow those that have that type of knowledge, that type of specific medical knowledge, to do the kind of work they need to do. The allowance of the individual to penetrate through various space-times is part of a meditative process that actually opens portals. Now, these portals in space and time are such that they are energized by the participants. Therefore, to know what a portal is essentially need to look at examples of portals in the past which have appeared as, say, openings in the sky where the face of God might appear, or an angel, or rectangular openings, circular openings, mystical caves where doors have appeared, and there are all types of experiences where there's portals to other dimensions that open up in the presence of people, observers, and it is through that portal that they see entities on the other side, or they may see void, or they may not even look too far and only see the mechanism of the portal itself. The activation of portals and the creation of portals as such is not an easy matter for most people, most humans, because we are not trained in the activation of portals. And portal technology is part of this entire technology of Lightbody, because the Lightbody is a body that is in a different space and time. In fact, it is contacted or realized or seen through the eyes of one that can see through those veils into those realities, those other parts of space-time. Therefore, the easiest methodology is to establish space-time portals through the eyes. And the gazers of ancient times would use crystals and other mediums to see into these portals. Now, these portals of space and time are such that they allow the gazer to see where their mind will take them, although in many cases the gazer was in fact taken to other places they may have not have known about or wanted to go and meet entities that they did not know about and maybe didn't want to know or did want to know. It all developed into a great science of creating portals. These portals are places in which this healing or these miracles can occur. And this connection that people can make with this space-time world is one in which there's many practices throughout the world that allow individuals through certain inclinations, religious practices, yoga, various exercises, and with the popular self-help books and all, there's many avenues to take to achieve the knowledge of making these portals. And there's many, and in fact the magical tradition itself is all about having access to these portals and the beings that lie on the other side. These beings can be essentially known as light beings, and they are as pictured through history, and so they are quite real in that realm and must be given their due respect and not venerated, but in fact, unless they deserve your veneration and are worthy of it. The danger of using the light body without adequate protection, such as the religious protections, such as devotion to God or the whole features of God, such as in the Holy Spirit or Jesus or Mother Mary or other religions, have various aspects of God that they might see and see them as portrayals as in these light being forms. Now, the light beings in many of these mythologies are in fact very human-like, yet some of them are monstrous to our human perception and unrealistic in any geological reconstruction of animals that lived on Earth. So in this light body realm, there is in fact beings with entirely different types of physiologies and consciousness purposes that the apprentice will encounter. In doing the light body surgery, one may encounter all kinds of energies, so it is necessary to have the right types of entities in presence during the surgery. And that's why lots of prayer is called for, and a perimeter of prayers and prayers. And the devotional aspect of this has to be such that it can establish the entire framework of a portal in space-time that allows the healer to draw upon the abundant ambient energy that allows healing to occur at the degree that it is occurring in that particular situation, whether it be a psychic healing clinic or such. The ability of the two types of healers, one is the type that relies on a lineage of healers and the other that relies on their own technical know-how. These two types can have the same type of effect and success or even failure, because this is not a guaranteed type of procedure. Any of these things, psychic healing and such, are not a remedy for death. It is a factor that may help the individual to live or to grow or to heal, but it is not a substitute for God's will. These types of healing are seen in the spirit world as a energetic event, and seen from the lineages of the patient, it is also rather shocking, yet it is amazing to them as well that their kin could be connected to the psychic and the other realm that they are in through these portals, and it is in fact a very binding experience to perform these types of surgeries, and it not only binds the healer with the patient temporarily, but it also brings the patient's lineage spirits in closer contact. And this is necessary so that they can help effect the changes within the body of the patient. So in fact, those using these psychic surgical methods are in fact contacting many spirits, whether they were trained in spirits or not. And to not use spirits in this type of energetic healing would possibly be a violation of the trust placed in the living gene and body of the person. They are all there, and it's the individual at the moment that has to protect their own lineage, their own genes, and their own identity in the process of growth in life. The psychic surgeon may encounter objects and even entities within the patient that have to be removed, and these things may occur in a natural manner, or they may occur in an unnatural manner. Therefore, it may be a blockage that somehow the hand of the psychic surgeon can somehow affect a change, and the blockage is corrected. The types of things that might be removed or inanimate objects, tumors, and other types of problems that have occurred. The healing process itself is one which requires great amount of manipulation on a rather microscopic level, and so it isn't easy for the knowledgeable doctor type to do all this without their actual tools, their scalpel and other tools and equipment needed for an operation. Therefore, they have to use their knowledge and their experience in the visualization and the capability and the skills. And therefore, even though they may not have the particular lineage skills, they should be able to use their Lightbody skills in these operations. That means that their Lightbody has to be trained in these procedures and techniques so their Lightbody can do these types of work. The direction of the Lightbody by a scientifically coordinated consciousness is essential towards a continuation of a type of methodology. And the methodology that is used by the light physician is one in which they use the parts of their knowledge that are accessible, such as images of actually cutting through or around diseased tissues to remove it, and then being able to use a light scalpel to do the same, are using the hand in order to see it as the separating device, the scalpel as such. And then, because of the nature of the hand being in another place in space and time, that the hand can in fact feel between the diseased and healthy tissue and separate that by the light field within the emanation from their hand in the body, and therefore be able to separate the good from the bad, as it were. This type of motion within the body can be quick and rather seamlessly occur, and there doesn't really have to be for the intuitive healer, a lot of knowledge of the anatomy of what is going on. In fact, what's going on is not necessarily good for them to know if they're not inclined to know. And it is more that they have faith that they can do what they can do, and to allow the entire healing process to occur. The scientific healer, or the doctor of this psychic surgery, has to do a type of feeling and sensing in the body that requires them to have an entire knowledge of the body, of the processes, and the placement of the organs, and the energies emitted from these organs, and the types of problems encountered in the anatomy of the patient. These types of knowledge is learned through education, through going to medical school and such, and are not available to the regular practitioner of psychic surgery. The psychic surgeon, in fact, is one that can take a much greater knowledge base into this practice if they had that knowledge base. And it is, in fact, necessary that eventually that psychic surgeons learn real surgery as well, some of them as well, so that there is a complete knowledge of this procedural concept here of psychic surgery. The approaches to psychic surgery are therefore varied, and the traditions are also varied, mainly in the Philippines, some in Brazil, and other places where faith healing and other types of miraculous healing is pursued, observed, and practiced. The entire Lightbody teaching has been fragmented over the centuries, and in an ancient time there was a knowledge of Lightbody. Lightbody technology is a inherent right of the peoples of the earth, and is something that can be pursued that is not necessarily dependent on their any particular religion and their social place in their profession. In fact, Lightbody is a technology. It is like learning a particular skill, such as mathematics or physics, or in this case, there is the possibility of learning the Lightbody healing surgical technology as well. Other Lightbody technologies include the sciences and other math, and the necessary knowledge in order to do Lightbody work on the more advanced levels is left for advanced teaching.